I'm just going to give you an overview of the nursing and midwifery programs that we offer in NUI Galway. So there are 3 programs that we offer: Bachelor of Nursing General Nursing Programme, Bachelor of Nursing Science Mental Health Nursing, and Bachelor of Midwifery Science. Now these 3 programs run over 4 years, and at the end of the 4 years, students become registered general nurse, registered mental health nurse, or registered midwife. The 4 years of the course consists of 2 semesters, and the semesters run from September to Christmas. That would be semester 1, and semester 2 then runs from January until May. And in each semester, there are theory and practice modules. So the theory modules consists of either nursing and midwifery focused modules, and also biological science modules. And these modules consist of topics like anatomy, physiology, pharmacology, bacteriology, microbiology, and pathology. And students also study social sciences, and topics that will be covered in this area include philosophy, law, psychology, philosophy, and social sciences as well. Throughout the 4 years of the program, students study clinical skills, and there's a huge focus in clinical skills. So as well as the theoretical components of the modules, there are also practice components. So students go out into clinical practice, both in the hospital setting and in the community setting, both for general nursing, mental health, and midwifery students. Practice placements commence from year 1. So students, for example, first year student nurses, midwives, they come into college in September for 8 weeks. And after that 8-week period, the students go out into clinical practice. So in that first semester, from September to Christmas, students have 4 weeks experience out in the clinical area. And after Christmas, they go back out into the clinical area again. So throughout the 4 years of the program, the students have a combination of both theoretical and practical components. Students really enjoy linking the theory with the practice, and they really look forward to coming back into college for their theory components, and then, you know, learning skills in a very safe environment in the clinical laboratories, and then going back out into practice into the clinical areas. In the 4th year of the program, both for midwifery and general nursing, students spend 36 weeks in clinical internship. And during this period of time, students actually get paid a salary for 36 weeks duration. And the students come back into college for 4 weeks in the fourth year. And in that period of time, they study things like management and management issues, and they do a lot of simulations in relation to clinical practice. Also, St. Angela's College, Sligo, Sean will be here this evening to answer any questions about nursing in St. Angela's Hospital in Sligo. And in St. Angela's College, Sligo, they run 2 courses in nursing, one for general nursing and the other learning intellectual disability nursing. And the intellectual disability nursing program in Sligo, St. Angela's College, Sligo, is based on the principles of human rights, person-centeredness and empowerment. And the principles underpinning this program are principles of autonomy, active participation, inclusivity for persons with intellectual disability. And the course is offered in conjunction with the Health Service Executive in the groups in the Western region of the country. And again, the BNS Intellectual Disability Nursing Programme has placements both in the community and in the hospital, and it's a 4-year degree programme. And the 4th year, again, students do their internship. In the School of Medicine, School of Nursing and Medicine and Health Sciences, nursing is part of this school. So you've got the Bachelor of Medicine degree, Bachelor of Science, Occupational Therapy, Speech Therapy, Podiatry, and then you've got a Bachelor of Nursing, Science General, Bachelor of Mental Health Nursing, and Bachelor of Midwifery Science. Also, when a nurse or a midwife qualifies and gets their Bachelor of Nursing degree or their Bachelor of Midwifery degree, they also are eligible to be registered on a professional register. And the Nursing and Midwifery Board of Ireland is responsible for the registration of nurses and midwives. So when you complete the 4-year course, either in nursing or midwifery at NUI Galway, you also are eligible to be registered as a registered nurse or midwife with the Nursing Board and Nursing and Midwifery Board in Ireland. So if you're thinking about nursing and you think you may want to be a nurse or a midwife, there's different things you can think about. Like, are you somebody that likes meeting people and working with people? Do you like listening to people's stories, and are you interested in others? Are you interested in health and well-being? That's something else that you should consider. Is this something that you're interested in? Are you somebody that's flexible, adaptable, and to different situations that can arise? Do you like to analyze and problem solve? Because as a nurse and a midwife, there will be a lot of challenges and issues that you may have to analyze and problem solve on a daily basis. And are you self-aware? As a nurse, you will be, and a midwife, you will be caring for other people. So it's very important that you have self-awareness. And the other thing that's so important in nursing and midwifery is the teamwork. So working as part of a team. Do you like working with other people? Have you got good communication skills? And are you somebody that likes, have you got good oral and writing skills? So those are things that maybe you should consider if you are considering to become a nurse or a midwife. So the courses in NUI Galway, the first course we look at is the Bachelor of Nursing Science General Programme. And this programme, you become registered as a general nurse. And the role of the general nurse is to assist with the health and well-being of persons experiencing a change in their health status. And as nurses, we care for patients. We look after their physical, psychological, emotional, social, and spiritual needs. So it's a holistic approach to caring for people. The course provides an excellent foundation in the theory and practice of nursing and enables students to become competent, knowledgeable, safe, and highly skilled practitioners. On graduation, nurses are eligible for registration on the General Nursing Division of the Nursing Registrar, which is maintained by the Nursing and Midwifery Board of Ireland. This year, in 2021, the points for nursing were quite high, 496 points. And if we compare it to 2020, it was 476 points. The places that are offered in NUI Galway, the number of places offered for general nursing has increased to 84 places. And the requirements for nursing is you need a science subject. So the subjects for science would be either chemistry, physics, biology, physics and chemistry joint, or agricultural science. And the other subjects would be Irish, English and maths, and then any 2 other subjects recognized for entry purposes. When you commence your course as a general student nurse, you'll work in lots of different areas in both the community and in the hospital. So as a general nurse, you would work in medical and surgical wards. Accident and emergency, students find that very exciting. Outpatients department, where patients attend outpatients. Pediatrics, care of looking after children. Again, in second year, students have opportunities to work in the maternity department, in mental health areas, care of the elderly, and operating theatres. Those would be the specialist areas that students work in. All the practice modules are based in the clinical setting, and students work either in the hospital or in the community. The theoretical modules are focused on nursing studies and also on the biological and social sciences, as I've mentioned already. Then the Bachelor of Mental Health Nursing. Mental health nursing aims to assist people experiencing mental health issues to recover and to promote mental health and well-being. The course is offered in partnership with Galway Roscommon Psychiatric Services and the Salitre University Healthcare Group. On graduation, students are eligible for registration on the Psychiatric Division of the Nurses Register maintained by the Nursing and Midwifery Board of Ireland. And in 2001, the points for mental health nursing were 441 points. And just to compare it to 2020, 440 points. And at NUI Galway, there are 30 places for mental health nursing. Again, it's the same requirements as for general nursing. You need your biological science and 5 other subjects, including English, maths, and a laboratory science subject. In mental health nursing, a lot of mental health care is focused on the community, but also as a mental health student nurse, you will also work in mental health hospitals. So in areas such as acute mental health services, working with older adults in mental health services, working with people with enduring mental health problems, working with specialist clients, and then students have the opportunity to take courses on psychosocial interventions. And again, the theoretical modules students will undertake in mental health nursing are mental health nursing specialist areas, acute and mental illness, also social sciences and biological sciences, which are shared with midwifery and general students. Now, as a nurse, whether it be a mental health nurse or a nurse working learning disability or a general nurse, there are lots of clinical pathways where nurses can work in many specialist areas. So as we mentioned already, nurses may choose to work in medical, become specialist in medical areas. They may also decide to work in surgery. Nurses can also decide to work in the community as public health nurses, work in specialist areas such as cardiac nursing, cardiology. They can specialize in diabetes, dementia, renal specialists, work in accident and emergency, intensive care, infection control, wound care, practice nursing, perioperative care, oncology, caring for patients, cancer patients. Nurses, some nurses work in occupational health. They become nurse practitioners. And also, if you're specialized in mental health, you can work in adolescent mental health, caring with older people in mental health, working in acute mental health settings. So there are huge areas for nurses to work in. Also, some nurses may decide that they have a special interest, like was said in the previous talk, on medicine, in research, or they may go into management, or they may decide that they would like to work in education. So when a nurse qualifies in the different areas, whether it be mental health nursing, in midwifery, or general nursing, there are so many areas to choose from. So the Bachelor of Midwifery Science then programme, the midwifery degree programme consists of theoretical and clinical components to it, where students learn the art and science of midwifery. On graduation, students are eligible for registration on the midwifery division of the Register of Nurses and Midwives maintained by the Nursing Board of Ireland. Students get a broad range of clinical experience in areas like Galway, Mayo, Portiuncula and Sligo. The entry points for midwifery in 2021 were 520 points, and if we compare that to 2020, 495 points. In midwifery, there are 25 places in Galway. And as with mental health nursing and general nursing, again, you need the same English, Irish, maths, a laboratory science subject, and any other 2 subjects. In midwifery, you learn the areas that student midwives work in are in the antenatal ward, where they care for women when they're pregnant, also working in the labour ward, where student nurses get experience of caring for women actually in labour, having their babies. And then in the postnatal ward, students work with mothers who've delivered their babies, and they care for mothers and babies in the postnatal setting. Also, during a student midwives 4-year training, they also work in the neonatal unit, or the special care baby unit, where they care for babies who may have been born premature, or babies who just need extra support after being born. Also, student midwives get an opportunity to work in the community, out in the community, where they visit mothers and babies in their home after delivery. They also get an opportunity to work in theatre, and to work in the gynecology wards, and to work in mental health areas. Again, for student midwives, their experience is a combination of theory and practice, where they work in the maternity area and in the community. Again, subjects that student midwives will study will be midwifery studies, childbirth, professional midwifery practice, and again, student midwives will do biological sciences and social sciences. And these biological sciences and social sciences, as well as sharing these lectures with mental health and the general students, they all, as a student midwife, you will also do applied biological and social science studies. As a midwife, again, there are so many opportunities when you qualify as a midwife. You may decide to work in the antenatal caring area, caring for women that are pregnant. Again, you have opportunities to work in the postnatal care, caring for mothers and babies during the postnatal period. Again, some midwives like to work in the labour ward, where they care for women having their babies. Again, some midwives, when they qualify, they go on and do a neonatal course, where they become specialists working in the neonatal unit. Again, there's opportunities for midwives, when they've got experience, to work out in the community and to join home birth teams. Other specialist areas that midwives may work in are areas where their education of teenage pregnancies. Midwives may also have a particular interest in breastfeeding, where they decide to become lactation consultants. Again, midwives can go on and do advanced courses where they can become advanced midwifery practitioners. Again, some midwives may like to work in theatre and specialise in perioperative care. Again, there's loads of opportunities for midwives to work in areas in research, education and management. So as student nurses or midwives, the whole goal is that as nurses and midwives, that we provide high quality, safe, efficient, compassionate care to our patients, whether it be patients in mental health, in general nursing or midwifery. And the care that we provide to our patients is always evidence-based care. The care is always patient-centred, where the patient is always at the centre of our care. And as midwives and nurses, we want to care for patients in an individually, in a holistic way. And communication is at the core of what we do, so that patients are treated with respect and dignity. And as nurses and midwives, we realise that we're in a very privileged position caring for patients. And as we've mentioned previously, as a nurse or a midwife, we very much work as part of a team. So work as part of a team among your nursing and your midwifery colleagues, but as well as that, with the multidisciplinary team that will be working in the wards, for example, the doctors, physiotherapists, speech therapists. Everybody works as a team together, and that lies at the core of nursing and midwifery. As a student nurse and a student midwife, clinical skills are very much core to the programmes in nursing and midwifery. And we want, when student nurses and midwives qualify, we want them to be knowledgeable doers. In other words, that students will continue learning, because as a professional, whether you be a nurse or a midwife, learning is lifelong learning. So students are taught to be independent learners, to be self-directed in their learning. And during the course, students are assessed. There's different methods of assessment, written examinations, coursework, and students also do simulated learning, where they carry out clinical skills and they're assessed on their proficiency at carrying out skills. Also in the clinical area, when student nurses and midwives are working in the clinical area, they are also assessed. Their skills are assessed in the clinical area, and they have to complete what is called clinical competencies. So student nurses have certain number of learning outcomes to achieve during their clinical experience, and they're assessed and supported by their clinical preceptor, and they have to be deemed competent at the end of their placement. And students really, really enjoy their clinical placement, where they can put their theory into practice. As well as the requirements of achieving the points for the Leaving Certificate examination and achieving the required CAO points, students also are Garda vetted before they commence as student nurses or midwives, and they also are required to complete a vaccination programme. On clinical placement, students are supernumerary and they are supported by a registered nurse at all times during the 4 years of their degree programme. And the student has a preceptor, which is a registered nurse or midwife, and they facilitate students on the clinical area, and they complete the student competency and support students in the clinical area. Students are also supported by their clinical placement coordinator and by the link lecturer who visits the clinical sites. So in clinical practice, there is a lot of support for students as they go through the 4 years of their programme. As I've said earlier on, there's lots of career pathways for nurses and midwives. So a lot of student nurses, they usually choose to work initially, maybe for a year, and gain experience. And some students like to travel. So Irish nurses are renowned all over the world, and midwives for being very well qualified and very competent in their professions. So a lot of our students would travel, whether it be to London, to the US, to Australia, to New Zealand, and generally speaking, they come back again to Ireland, and they have opportunities as well when they travel to different countries, maybe to do different courses in those countries and to get experience of working in other countries. So student nurses and midwives find this a very attractive option, that when they do qualify as a nurse or midwife in Ireland, they have this option if they want to travel and to see a bit of the world and to get experience as a nurse in other countries. Also, some students may be very interested in, remaining in the clinical area, becoming a specialist in a particular area in the clinical area. And there's lots and lots, as I've mentioned before, there's lots of specialist areas that nurses, when they qualify, can specialise in. Also, there's opportunities. Some students may decide that they would like to work in education, and there's lots of educational programs, masters in education, are available to students if they are interested in going into the teaching aspects of nursing or midwifery. And research, there's again some students, particularly when they get into the 4th year of their programme and they do their literature review, or some students as well have opportunities during the summer where they take on research projects. And again, they find that they have a particular interest in research. So some students may decide after having some clinical experience that they want to specialise in research. And also there are some students that are interested from a very early stage in management, and there is lots of management courses the students can undertake, and they may decide to become a clinical manager, in the clinical area or in the community. So lots of career options for students as nurses and midwives. So this is a picture of the School of Nursing at NUI Galway. It's quite a modern building, and most of the lectures are within this Auris Myola in the School of Nursing and Midwifery, and we've got very good clinical skills rooms, and it's a very modern and very nice building. Here you will see some of our clinical skills here. There is a student, she's performing an exam here where she's just done a blood pressure on a patient. So you can see our clinical skills rooms are, you know, they resemble what a hospital would look like, and the students work here in a safe environment. And again, here you will see some students, they are looking at the OSCEs that they have performed in practice. And again, you'll see other students here where they're caring for a child, an OSCE. So you can, further information you can get on the NUI Galway website, in the School of Nursing and Midwifery website, and on our Facebook. And again, the Nursing and Midwifery Board of Ireland, there's information on that. And we look forward to answering questions after this presentation. And apologies again for my technical issues in the beginning. Thank you.
That's great. Thanks, Teresa. Can I call on Andrew and Declan and Sean maybe to turn on their mics and cameras and to join us? That's great. Thanks, Declan. I'm just going to start because there's a lot of questions coming in on the chat. Some of them are repeated questions. So one that has come in quite a lot is around placement and where placements take place. Declan, do you want to take that question for me?
Yeah, sure, Caroline. Depending on the programme students take, they can be expected to be placed largely within the SAILTA healthcare group or their respective community care area that covers the large part of Letterkenny down through to Galway, Roscommon areas. And we would, across all our programs, indeed nursing, midwifery, medicine and other programs, use healthcare settings, be it in hospitals or community care areas across the region. And students will be placed in one of those areas. And as Andrew said in one of the chats to somebody, depending on the course requirements and the regulatory requirements, all students in all programs are required to get a certain number of weeks experience in particular specialty areas, and those specialty areas could occur across the region.
Great, thank you. Thanks, Declan. Andrew, I might come to you next, because a question we get asked quite a lot in the classroom is about, you know, exactly what a mental health nurse does. What service to patients does a mental health nurse provide? Could you just give us maybe an idea of what the day in the life of a mental health nurse might look like?
It's a constant issue within mental health nursing to define mental health nursing, and yeah, there is no single day in the life, and I would use a quote to start that, because there is no health without mental health. So if we think on a continuum, what you're going to have are nurses working in the community with people who've been referred by their GPs because they're depressed and anxious, and that, you know, you're looking at 1 in 4 people across the lifespan, or 1 in 10 people at any given time would benefit from that kind of input. So that would be in the community, right through to, at the other end of the scale, people who are genuinely at risk to themselves and require emergency input, so to speak. So they would be in inpatient settings, and that's where a nurse, a mental health nurse, would be doing shifts and would be with people 24/7 to make sure that they are getting through the crisis that they are in at that moment. And all of that is based upon, as Teresa was saying, excellent communication skills, and specific to mental health nursing is the ability to build therapeutic relationships and help people towards recovery, which is an ongoing process through life. And that is about identifying people's strengths and their needs and working to meet their own goals. So it's very nuanced, and it's very much about knowing what the person's individual needs are. Communication for mental health nursing.
Thanks, Andrea. I think that's one of the best explanations I've ever heard for what is involved in mental health nursing. So thank you for that. And Sean, I want to come to you next because St. Angela's do offer 2 undergraduate nursing degrees. Do you want to just maybe quickly mention those 2 degrees and just talk a little bit about the 2 of them for us?
Of course. So St. Angela's College in Sligo offer general nursing and intellectual disability nursing. So 2 very different courses. 2 very different disciplines. The general nursing course is exactly what NUI Galway offer, but we just offer it in Sligo, so it's a different setting. The clinical placement will also be based in and around the Sligo area for our general student nurses. A lot of placement for those students will be in Sligo University Hospital with our colleagues there. The second nursing course we offer is intellectual disability. And I do get asked a lot every year, well, what is the difference, or define what intellectual disability nurse is. So the easiest way, and hopefully the most clear way I can explain it, is an intellectual disability nurse graduate will be more community-based than, would say, a hospital setting or a clinical setting. So throughout the country, there have been these larger institutional hospitals that are home to service users with an intellectual disability. For example, Down syndrome or autism. So these larger institutions are closing as we speak. A lot of them have closed actually. And those service users are being brought back into the community. So they're now living in community care homes, day settings, training centres, specialist care facilities, and of course, children with intellectual disabilities have to go to school. All of these areas in the community require a nursing presence. So that's where our ID nursing graduates end up. So hopefully that will explain the difference between both of the disciplines. The placement settings for the ID student nurses can go a little further than Sligo. We have partnered with areas in Galway, in Donegal, Mayo, and we've even gone as far as Cavan. So the ID clinical placement, or ID community placement, I should say, they can go a little further afield. As opposed to the general student nurses who will be mainly Sligo based. So hopefully that explains it.
Great, thank you, Sean, thank you. Another question that has come up a little bit is about, and maybe it's a question for both Declan and Teresa, but you know, the differences and the similarities between general nursing and midwifery. I don't know if one of you wanted to take that, Declan, maybe.
I might jump in.
Yeah.
So Teresa and I are both general nurses and midwives, and Teresa's focus now is in general and some midwifery, and my focus is largely midwifery with some general. The programs are quite different, although there is some shared content in the initial years 1 and 2 in particular. But they are quite different programs. The clinical placements really are very different. And therefore the theoretical input that students get from years, well, throughout all of the years, starts to prepare students for practice in those different clinical settings. So I would encourage anybody who's maybe to think carefully about which one to choose across any of them, across intellectual disability, general, midwifery, mental health. Think carefully about which program you think you're best suited for and most interested in pursuing.
Great, thanks, Declan. Teresa, did you want to add anything there?
Yeah, I think it's important to know that if you do a general program or midwifery or mental health, you become registered on that particular register, and you can only practice area. So as Declan said, it is important to know which area you really want to do and to pursue that area. Now, there are opportunities afterwards. For example, if you're a general nurse, you can go on later on and become a midwife by doing an 18-month postgraduate course. But it is important to know that once you're registered on a register, you can practice only within that registration.
Okay, thank you, Teresa. I think we've time for one final question. So Andrew, I might come to you. And again, it was a question that popped up quite a lot in the chat. It was around study abroad opportunities and Erasmus. You know, what are opportunities are there for the nursing students to do some study abroad?
Well, I think as Teresa touched on in her presentation, General nurses, midwives, and to some degree mental health nurses have huge opportunity to work overseas. They are sought after. It is the case that, and I would let Declan speak from a midwifery perspective, and Teresa to the general, that mental health nursing have opportunities, but they're not as broad in terms of working abroad. And it goes back to that idea on the last question. They are very different disciplines and they do very, very different things, but the opportunities are there. Certain countries will ask further exams, further requirements for people to travel. But yes, they're sort of, I have certainly filled in numerous references, especially for people to go to the UK and work, you know, all across the UK as mental health nurses. I know that general nurses and midwives are similar there. So, you know, huge, huge opportunity to travel out of all three of these courses.
Great, thanks. Thank you, Andrew. And I can't let you go because always when we're in the classroom, myself and Gráinne and Eilish, we are always encouraging the boys to consider nursing as a career. So I have Andrew and Declan in front of me, and I just want you to maybe just, we're very tight on time, but just maybe to say something to some boys who are listening tonight and maybe who are considering it. You're just on mute there, Andrew.
I'm just going to say, I mean, mental health nursing tends to have slightly more, you know, in the way of men with it. But, you know, we're talking in a class of 30, we might have 2 or 3 even at this stage, or maybe 4. It is a great career with huge opportunities, community, inpatient, and working across the board. It is not considered as gendered as it once was. Perhaps I would let Declan talk here in terms of the opportunities, because in mental health, it's always been there. So I'm maybe not the best to talk to that.
Great, thanks, Andrew. Declan.
And in midwifery, there would be fewer men than in the other general nursing or mental health nursing, but increasing numbers across all of the providers of midwifery bachelor's degrees in Ireland and elsewhere. So we would encourage, I've loved it as a career. My colleagues who are also men have similarly loved it. And I would encourage anybody, don't put off, if it's a career you think for you, follow that career path. And I assure you gender won't come into an issue whether it's for you or not.
Great, thanks Declan, thank you.